Hello everyone, hello friends. Greetings from Nayati Healthcare. I am Dr. Amit Bhargav. I am Director of Medical Oncology at Nayati Healthcare, and we've just concluded November, which we observe as Lung Cancer Awareness Month. So today I'll be talking on lung cancer and some myths about lung cancer, how things have changed in lung cancer, and what is the importance of getting a biopsy in lung cancer. So first of all, let's talk about some Indian scenario, what actual real scenario happens in our country. If you see in India, tuberculosis, or especially pulmonary tuberculosis, was very prominent at one point of time. Now, when I see a typical lung cancer patient in my clinic, most of them has actually received 2 to 3 months or 4 months of anti-tubercular treatment. Normal presentation of these patients is either due to cough with blood, or some kind of a chest pain. The treating physicians, they invariably do a chest x-ray and certain blood tests where they find an ESR is high, or a chest x-ray shows some kind of an effusion or a mass in the lung. Now, without even investigating further, most of these patients, they undergo anti-tubercular treatment, and once they fail anti-tubercular treatment after 2 or 3 months, or there is a progression in symptoms, these patients then are further evaluated, and we have lost this precious 3 months time. So one of the foremost thing, that whenever we have a patient of cough or cough with hemoptysis or blood in cough or chest pain and an x-ray showing a mass, we need to evaluate it properly, either do a CT scan followed by a CT guided biopsy. If there is a fluid, we need to remove this fluid, send it for evaluation, just rule out that there is no cancer or prove that that's a tubercular lesion, only then start any kind of treatment. This may take 5 to 7 days to evaluate the patient, but we are much wiser in starting the treatment in this 5 to 7 days before we actually start either an anti-cancer treatment or anti-tubercular treatment. Now let's talk about what has changed in lung cancer. When I was in my training at Tata Memorial Hospital, at that time we hardly had any promising even frontline treatment for lung cancer. Our lung cancer patients who were not operable, they hardly used to survive for more than 6 or 9 months. And most of these patients, we were even unable to do a proper biopsy. We used to treat these patients on the basis of FNACs, but that era is gone now. Now, biopsy has actually revolutionized the treatment of lung cancer, and the kind of investigations that we do on a biopsy has actually changed. Most of the cancer patients, lung cancer patients, they may not even require chemotherapy. Now, when we talk of biopsy, what I see in the area where I practice, especially in Mathura or tier 2 places, and most of the patients in Delhi as well, or big metros as well, they fear biopsy. Now they feel that if we do a biopsy, the tumor may spread. This is the commonest myth that I face when I treat my patients. And when I tell them that we need to do a biopsy, their thing is, no, we don't go for biopsy because biopsy is going to make our tumor spread. That is wrong. If we do a biopsy, and what we do on biopsy, we don't even just do a histopathology on it, we do a immunohistochemistry where we come to know what type of a cancer it is. Then further we do testings like EGFR, ALK mutations, ROS1, MET, PDL1 receptors. All these receptor analysis we do, and which actually tell us how sensitive the tumor is to certain kind of chemotherapeutic agents, or what medicines are going to be used. There was a time when all lung cancer patients used to undergo chemotherapy, but now I would say approximately 25 to 30% of these patients may not require chemotherapy at all. If they are positive with some receptors like EGFR or ALK or ROS1, then we have very good tablets with them which can give them a good amount of survival benefit. And even we have seen patients who go into complete remission with these tablets, and they continue these tablets for long. So the take home message today from this presentation is that one thing, we should not fear biopsy. Biopsy is the foremost important, and request your doctors to get immunohistochemistry done on the biopsy so that we know what type of lung cancer we are dealing with. And number two, we need to do some kind of analysis with EGFR, ALK and other mutations, which is currently the standard of care for lung cancer. And after we do all these things, then only we plan the treatment. Now there is one more thing that we do. Suppose if we are getting adenocarcinoma in the lung. Now getting the EGFR, ALK and other mutations done takes approximately 15 to 20 days, or maybe 3 weeks or 4 weeks at certain places. So meanwhile we can start certain chemotherapy for these patients, but only after taking the biopsy and sending the blocks for further analysis after we get adeno-CA. And once the reports come, then we take a call whether we can continue chemotherapy or we can change to the tablets, or what we call as tyrosine kinase inhibitors, depending on how the patient is responding to the treatment. Suppose a patient comes who is EGFR positive and he is responding very well to the standard first line treatment with pemetrexed or cisplatin, then my choice would be that we continue chemo till the patient is responding, and maybe once he finishes 4 stipulated cycles, we can switch over to a tyrosine kinase inhibitors along with. Okay, that's a physician's choice, but the most important is getting a biopsy done and followed by a mutation analysis where we need to do these testing so that we can know what actually will respond and how the patient is going to do with the further line of treatment. One last thing I would like to say, that most of our patients, especially in lung cancer, they are either smokers or they are tobacco chewers. 80% of these cancers are linked to tobacco. So one request to quit tobacco and see if your neighbors, your friends, your family, if anyone is smoking, please ask them to quit smoking so that we can prevent lung cancer as much as possible. And before starting tuberculosis treatment, please evaluate that we are not missing out a cancer and we are treating a cancer with anti-tubercular drugs. Thank you very much.